Hi, I'm Mr. Radoff from the RBS Dog Therapy Group. This video is an introduction to animal-assisted therapy and our group. We studied under Gadi Ronin, who is a major figure in animal-assisted therapy in Israel. He runs a farm in the Shomron and sees dozens of patients a day, and he's been doing that for about 20 years. What we do is we work on specific challenges to patients, especially children, sometimes in conjunction with a psychologist or referred to by schools. What is animal-assisted therapy? Animal-assisted therapy dates back to Freud, actually, who used a dog in his sessions, although not in any structured way that has been documented that I'm aware of. It came into its own in the 1960s under Dr. Boris Levinson and has been gaining popularity ever since. It has a large number of applications, and some details of those are very technical, so I'm not going to go into them. But I will summarize one or two examples. It is used often with children, although I have seen it used with adults. One major example that people talk about these days and has received a lot of press attention is autism and autism spectrum patients. It has done some spectacular things with autistic patients, using dogs, horses, and dolphins. When animals are used in a structured activity with an autistic patient, they are able to learn in the pace that suits them about relating to people and how to regulate their own sensory stimulation, which are the major challenges for an autistic person. Because they have to relate to a being that moves and makes noise and has feelings, and sometimes does the unexpected, and because animals are calmer, simpler, and less threatening, and more trustworthy than humans, the patient is not overstimulated or panicked, but the patient can still learn to relate to this other being. It has been at times amazingly successful in cases where nothing else has worked. Other areas where it has worked very successfully is with ADHD patients and depression, post-traumatic stress disorder, and actually a variety of other things. In addition to occupational therapy, which is a whole other profession. Some other questions people have about therapy is, well, if dog therapy works so well, what if I just get my child a dog? Will that do the trick? And the answer is no. Although having a pet in these circumstances can help, it could also make things worse, and it will almost certainly only have a fraction of the benefits because getting a pet is an unstructured activity, whereas what we do is structured. It can also be used as an observation tool where we learn a lot from the child and by seeing how he interacts with the animals in his fantasy world of play. And that gives you, as a therapist, a chance to see how the child reacts to unknown stimulation from the outside world, whereas in play therapy or art therapy, it's entirely controlled by him. And this gives us real-time access to what the child is thinking and how he reacts to situations. Those are just some examples. So if you'd like to learn more and look up some more of our technical information, you can go to rbstherapydogs.com and click on the For Professionals link. Hello! It's a butcher movie!